Hi, my name is Kelsey Cameron. I am the lead BCBA, Board Certified Behavior Analyst at Shaw Children's Institute. And I'm just going to talk to you a little about what to expect at your first appointment for ABA therapy at Shaw Children's Institute. So, how do I get started with ABA therapy? And ABA therapy is applied behavior analysis therapy. And if you want a little more information, we have a previous video of like intro to ABA. And then I think coming up in April, me and Hannah Burris, another BCBA here, are going to do a misconceptions about ABA talk. So look forward for that one. So how to get started. First, we will need a referral from a doctor. And then secondly, you'll go on a wait list depending on what you need. Right now, most of our afternoons are full, so we only have some morning appointments available. So it kind of will just depend on what times you're available as to what the wait will be. And then finally, when we're ready to take you off the wait list, we'll kind of give you a phone call, and it'll be your interest in ABA here. If you're receiving services at another ABA clinic, we can take you off our wait list. You can't receive ABA at two different places. So you can't receive in clinic here and then at home with another provider. Insurance won't approve it. That's kind of when we'll ask your availability. So if like right now, if we were to call and all you were available were afternoons, we would say, okay, well, we'll let you know when we have something in the afternoons available. Right now, we're kind of full in the afternoons. Those usually fill up the quickest because everyone wants after school or like miss as little school as possible. So morning appointments, we can usually get clients in a little quicker. Okay, and then the insurance part. So once we call, you guys say, hey, yeah, we can do this time. Let's do this. We will send in an assessment prior authorization for insurance. And that usually takes around 2 weeks to get back. It kind of just depends on what insurance and how kind of behind they are and how kind of behind we are. So, but usually around 2 weeks, we'll give you a call. We'll schedule that assessment. So once we do the assessment, and we'll talk a little more about what goes into the assessment in just a second. And then once we do the assessment, we'll write your treatment plan and we'll send it in for another authorization to get approval for your hours that we're requesting. Well, that usually takes about 2 weeks as well, getting that back. Then we'll schedule your appointments and then treatment sessions will begin. So the assessment appointments are going to be an assessment given by a board certified behavior analyst. So that's either going to be me, Kelsey, or Hannah Burris is another BCBA that we have on staff here. And we may or may not have a registered behavior technician with us, which is an RBT, which is who will typically see your children in the later treatment appointments. So, but me or Hannah will do the initial assessment. It's typically scheduled for 2 hours, usually doesn't take that long, most of the time 45 minutes to an hour. We kind of use this time to speak with the caregivers. And that's sometimes why it's beneficial to have an RBT in the room is because they can kind of pair and kind of get to know your child while we talk and kind of see what kind of things we're trying to work on. We're working on building rapport with your child, and then we'll answer any questions that you may have regarding ABA therapy, kind of what it'll look like in the long run. And then we'll kind of go over your availability. So again, we'll kind of just reiterate like, hey, these are the appointments we have available. Will these work for you? And if at that point, if something's changed and you're like, oh no, this won't work, we'll probably have to put you back on the wait list if it's something that we don't have available at that time. So again, after that, we would write your treatment plan and then send it in for your prior auth. So at that point, it'll be like 2 weeks. We'll call, schedule those, and then we'll start the treatment appointments, which typically are done by RBTs, conduct most of our appointments, with BCBAs kind of popping in maybe once a week, once a month, just kind of depending on what you and your child need. We're trying to do monthly parent check-ins where we kind of just check in and go over maybe a specific topic a month. And those kind of like me and Hannah do have some direct care with some clients. It just kind of depends on the schedule again. Our appointments are typically play-based, so they will be more, it'll look like we're playing, but I promise we're working on those play skills like functional play skills, functional communication. We're doing a lot of incidental teaching, just working on those conversation skills. And those first few appointments will probably look more child-led, especially while we're building rapport. So it's all going to be about like pairing. We want your child to want to be here. We want them to trust us. We want them to come to us if they need any help. So that's kind of how those first few appointments will look. And then, especially in the beginning, it's always nice if we can have a parent in an observation room or if it's available, if not in the lobby, just so your child's coming to us if they need something so we can build that rapport. So we can work on those functional play skills, functional communication skills, and things like that. And then kind of depending on age and skill level, we'll kind of determine what goals are being introduced. And I forgot to mention during the assessment, we will do like a short little direct assessment, just kind of depending on how cooperative your child may be. I know a lot of kids come in and they really won't do anything in a demand situation. So we kind of have to it may start out looking like, well, they can't do this skill, even if they can. But then when we start treatment appointments and work on like some compliance and just like knowing that once they do this skill, they can go back to playing. Those will be like the goals that we're working on. So, and then those goals will be set up from that assessment. Will kind of depend on how we work on those goals when they're being introduced in the treatment session. So some of our kiddos, it'll be more like in the floor natural environment training. Some kiddos will start working on transitions to the table, especially if they're school aged. It's something that they'll do at school. We try to transition to the table and have like a work turn and then a play turn. So it may be like 4 or 5 tasks, like simple, easy. Hey, what is this? Do this. And then we'll kind of, okay, it's your turn. You get 4 minutes to choose the activity. So that's typically what our treatment appointments will look like. Especially for those younger kiddos, like 2 to 3, they're probably going to be mostly in the floor. We're not going to do a lot of table transitions or setting. We'll probably work mostly on functional play skills and things like that. That's pretty much it. So, they're pretty play-based. We're building rapport the whole time. And we'll kind of just go like me and Hannah will be in kind of frequently to kind of check in and make sure everything's going all right. If we need to add more goals or things like that. But yes, so not a lot of stuff, but those are typically what our first few appointments look like. And hopefully that will help you in the future.